I recognize the member for Cowichan Valley.
Thank you, Mr. Speaker. I'm pleased to stand today and support Bill 11, the Vehicle Insurance Amendment Act. This bill will fundamentally reform ICBC from its current litigation-based system and adopt a public care-based model. The BC Green Caucus has long advocated for the need to fundamentally reform ICBC, and we welcome the decision to adopt a public care-based model. ICBC in its current form hasn't served the needs of British Columbians very well, and it's become extremely clear in recent years that the status quo is financially unsustainable for ratepayers around the province. At the centre of our conversation about reforming ICBC needs to be the health and well-being of British Columbians, particularly those who are injured on the road. Looking at the evidence, I'm convinced that a care-based model, if implemented correctly and carefully, can provide significantly better care for anybody injured on our roads, particularly those who face catastrophic injuries. So I'm pleased to stand today to welcome this transformation of ICBC. In correspondence and meetings with people since the legislation was first introduced, I know there were many questions about how this change is going to work. One theme that has come through again and again is a widespread lack of trust in ICBC. For these reforms to be successful, government and ICBC will need to earn the trust of British Columbians as they work to implement this new system. It is absolutely critical that the government lead the way in creating a significant cultural shift in ICBC in order for the public trust that they will receive the care, in order for the public to trust that they will receive the care and financial supports they need if they are injured. Government needs to lead the shift away from our current adversarial model and towards a collaborative approach between ICBC and our healthcare system, one that puts the recovery of people at its center. ICBC's mandate must be reformed to leave no doubt that its focus is supporting British Columbians to get the care they need to be well. ICBC, like all insurance, should be there to support people when they need it. Adequate coverage to get well should not be something people have to fight for in the courts. Our current litigation-based model provides some support for injured drivers, but beyond a relatively modest level, they are forced to sue what they need in the courts. You can only access additional compensation if you successfully sue someone at fault. This means that in cases where you're injured but there's no one to sue, like if you run into black ice or hit an object, you can be left with completely inadequate care. This will change with the transition to a care-based model. It is critical that under this new system that people are able to smoothly and quickly access their support and compensation they need for their recovery. A care-based model only works if British Columbians can quickly and reliably access the care they need. This includes making sure the new system works well for the many British Columbians who do not have a family doctor. Throughout the province, particularly in rural areas, people already struggle with access to medical professionals. The success of the proposed care-based model hinges on healthcare professionals working with ICBC to ensure people will get sufficient care. It is critical that the system equally serves the needs of the many people in our province who don't have a family doctor. Otherwise, people without a family doctor risk being left behind by this system. ICBC's finances, year after year, have led to escalating rate hikes for drivers, worsening the already crushing impact of our affordability crisis on the people across BC. And the billion-dollar-a-year write-offs we have seen in recent years are also fiscally unsustainable for the government. Fundamental reform to ICBC has clearly been needed for years, and in fact, the 2017 Ernst & Young report that was written for the government, where they provided 4 options to reforms to provide more affordable and effective insurance. They found that numerous and substantial changes to the current system were required, even just to slow the trend of year-on-year rate hikes, let alone provide any rate relief. They found, and I quote, that this suggests that the current system is not working as intended, BC drivers are having to pay significant and increasing auto insurance premiums to fund a system that is returning less than 60% of premiums to the premium payers as claimant benefits. In order to achieve the goal of being able to reduce basic premiums, they wrote that one option is to, quote, fundamentally change the design of the product from its current expensive and adversarial nature to a treatment-focused comprehensive care model, end quote. And that is what we are debating today. Ernst & Young estimated that savings under this objective could be approximately $1.4 billion. They found that a similar scheme design achieved stable costs and highly affordable premiums in Manitoba and Saskatchewan and in New Zealand, and all are publicly managed auto insurance schemes. Indeed, ICBC expects to save more than $1.5 billion in legal fees and other costs associated with the current litigation-based system. These projected cost savings are what allow for substantially higher levels of care and financial support to all injured drivers. Currently, BC's premiums are amongst the highest in Canada, and the government believes that in addition to delivering better care, this change could lower ICBC premiums by approximately 20%, or an average of $400 per driver. It is also important to note that drivers are still held accountable in this new model, as ICBC premiums are still based on driver risk and driving record. So if you cause an accident, you are still held accountable and will be paying higher premiums. The other option that has been raised by the opposition and select stakeholders has been the move to privatize ICBC. While we've been clear from the beginning that all options for reform should be on the table, a move to a private system would carry many risks for BC. It seems unlikely that the private system could provide better care and improve health outcomes for people injured on our roads. I'll be discussing the extent to which the government government modeled other alternatives in committee stage, and look forward to this discussion. The potential of the reforms in this bill to deliver substantially better health outcomes for injured drivers and more affordable rates for all is why my colleague and I are happy to support this transformation of ICBC. This change, if done properly, can ensure that all those who are injured on the road will get the care they need to recover without having to go to court to sue for what help they need. Thank you.